here's my perception. My perception is you should be able to take teeth out comfortably enough before you even start thinking about placing implants. Because for me, that was around about 3 to 4 years afterwards. Now, when I see any sort of extraction, it doesn't faze me as much. Before then, I was like, am I going to be okay? Am I not? Now I reach a position after the 4-year point where I thought, okay, now I can do some simple surgicals, happy to section elevate. Whereas some dentists might jump straight into the deep end without even mastering extractions. For me, that's how I was once taught is a good point to consider about the surgical aspects of implant dentistry. What do you think about that? How do you know is the right time? And do you need a good restorative background before you start going into level 2 and level 3 of the implant pathway you described?
Okay, that's another very good question we always get from people who are passionate. They want to do something as quick as possible, but then they want to check, is it good time for them, or are they doing it too early or too late? Now, my advice would be, after you finishing your dental degree, obviously you've got to have 1 or 2 years of general dentistry experience. And you're absolutely right. You need to have some knowledge about restorative techniques in general. You need to know how to take a tooth out. And not only taking a tooth out, you need to be learning and focusing on how to be gentle in taking teeth out. Because when it comes to implant dentistry, it's all about the bone. It's all about that labial plate, which is in 87% less than 1 millimeter thickness in the anterior zone. So you could see we're talking about very thin structure. And it will make or break your implant case in the future, having that labial plate intact or not. So absolutely with you that you need to have good skills, the minor oral surgery skills, some restorative understanding. But on the other side, nowadays, people like me and other directors of other courses, whether it's university-led or private-led, we acknowledge that, and we started to integrate this as part of the education we offer to our participants.
Hey, if you enjoyed this snippet from the Protrusive Dental Podcast, be sure to check out the full episode on www.protrusive.co.uk. It's also available on Apple Podcasts, Google Podcasts, Spotify, Amazon, you name it, it's everywhere. Also on YouTube. So check out the content. If you like it, please share it with a friend. Thank you.